All right, it's just a minute after 3 o'clock, and I think maybe we should get started. I'm so excited to see so many people. I can't see faces, but at least can see a lot of familiar names out there. And I want to welcome you all to the annual membership meeting for the National Birth Defects Prevention Network. Next slide. This is our meeting agenda. You'll see it's pretty packed, but we also want to take the opportunity at the end to answer questions. So if you have questions, please put them in the chat. Next slide. I want to just note to everybody that the wonderful face masks that you all got, hopefully you all got a face mask reminding you of the letter reminding you of the meeting, and I hope you're wearing it proudly. And we want to thank For Imprint. They provided these to us through a grant that Kim Hauser wrote for all of us, so we could have an NBDPN face mask. So I hope you like it as much as I do. Next slide. So it's been my honor to serve as the 2021 board chair. And I just want to acknowledge the many people, some of them listed on this slide, and many of you who are all out there that have done the work of the National Birth Defects Prevention Network this past year. Here you can see the list of the board of directors and then the list of the 2021 committee chairs. And these folks have all done such a fantastic job, and I'm looking forward to them sharing some of the work that's been done over the past year with you today. Next slide. So we're going to begin with a special guest, and I'm going to have Vanita Leadham introduce our special guest.
Thank you, Dr. Rasmussen. As she mentioned, I'm Vanita Leadham. I work in South Carolina, and I have the privilege of introducing you today to Asha Purohit. Asha is a social worker and young professional here in Columbia, South Carolina, and I had the privilege of connecting with her through the South Carolina Birth Defects Advisory Council. And Asha is passionate about access to care. Her experience and outlook have been shaped by her lifelong and ongoing interaction with the medical system as an individual with congenital defects and also related chronic illness. Asha was born with cleft palate, cleft lip, and a bicuspid aortic valve. While she was in graduate school here at DHEC, where I work, she actually had her first open heart surgery to repair a thoracic aortic aneurysm. This fundamentally shifted the course of her career and solidified her work in the arena of disability, birth defects, and chronic illness. Today, she practices outpatient pediatric social work in specialty clinics and is a licensed clinical social worker conducting therapy on evenings and weekends. Asha, thank you so much for taking the time today to talk to us about why you think NBDPN's work is important, and we are extremely grateful for the opportunity to hear from you.
Hey, good afternoon. Thank you for having me. So I just have a couple talking points. I know that there's what feels like a good bit of time laid out for me, so I'll talk through them. And if there's any clarifying questions for what I have to say, then I'm happy to take them too. So I believe that surveillance is really important because I think, as we would all agree upon, we have to know the true impact of birth defects in our population in order to design real strategies of prevention that are going to make change and have impact. To me, surveillance includes not just that, the passive tracking of the numbers of babies born with birth defects, but additionally what their outcomes look like, both short-term and long-term. So when I think about that, that means, of course, a few months into their life, a year, 3 years, 5 years, but even 20 years and 30 years out. So for me, I'm interested in what types of careers people are building, their quality of life, and what the cost burden is for them into adulthood. So I think about that when I think about, for me, what the impact and what the disease burden is for me into adulthood. And you know, I will happily turn on my camera real quick. Okay, so hey, so I think about that for me because you know, as my little bio says, I had my first open heart surgery while I was in graduate school, and actually completed my graduate work on time, zooming into my graduate classes before we really had this remote world that we designed as a result of the COVID pandemic. So I was Skyping into class with literally having a friend open their Skype and turn it around. And then my second open heart surgery was right when I launched my career with Palmetto Health. So that's where I'm interested in looking at what that burden looks like when we go into adulthood. And so I think that birth defect surveillance going that far out is what I picture when we look at that. And so then I think about families and the public caring about these things, right? And so I think that it's important to garner public support behind strategies of surveillance and prevention, because that's the only way that true change can happen. I think sometimes when all of us are talking about it, it can feel like we're a little bit in an echo chamber because we all already care about it. And so, but to get the public and families to care more, I believe that starts through small segments of the public, such as the impacted families, and then spreading outward from them into their community through education strategies, awareness campaigns, and the like. Because without that public support, change is necessary to create the long-term impact, such as public health campaigns like the fortification of folic acid, the expansion of newborn screenings, and even a push for universal health care. Are much more difficult, right? And so these are things that I conceptualize when I think about how do we make additional change that will help people with birth defects throughout their lifespan. And then I think about how NBDPN professionals are meaningful and can help in all these things that we're thinking about. And so I think that they're central, or you're central to making this change necessary to reduce the impact of birth defects. But of course, I'm not deluded into thinking that one day we're going to have a world that's completely without birth defects, or that individuals are going to be free from the lifelong stress of managing the impact of the subsequent chronic illnesses that can accompany them. However, I think that with robust research and evidence to support programs, individuals like myself can live more fulfilling lives when we have better access to the supports we need to reduce the burdens that are required of us to access them. So I think to sum that all up, one of the biggest things that I believe is needed with birth defect surveillance, research, and prevention, right, is even further out long-term monitoring, right, looking at these quality of life measures as well. I know that big focus on early intervention, and in working with pediatric clinics, obviously, I think early intervention is really important. But then I think as we have a chance to look further and further out, looking at what those quality of life measures are for people who are surviving and thriving into adulthood, but still managing those chronic illnesses that are a result of the birth defects. And so that's where I stand with that.
So eloquently stated. Thank you so much, Asha, for your time. And we always appreciate your attendance at the advisory council meeting. So thank you so much for sharing your wisdom with us as well.
Absolutely, my pleasure. Thank you for allowing me to speak.
Next slide. Thanks so much, Asha. So now we're going to go through the board update. We're going to give a treasurer's report and then talk about the next NBDPN meeting, which we're really counting on is going to be in person, and then a new collaboration between AMCHP and NBDPN. So first, a treasurer's report. Kim? And you're like me, you're on mute.
There we go. Hi, everyone. Thank you for joining us this afternoon. It's really exciting to have this many individuals take some time out of their day to join us for today's membership meeting. I want to give you a couple of brief updates. One is on our membership. The other is a financial update. So I'm going to start with membership. The network currently has 197 members, of which 15 of those are our lifetime members. And those individuals are those people that through the years have been been Godfrey Oakley awardees. The other 182 members, well, I think we're really excited that we have that number. It has been really interesting looking at how many individuals joined us in just the last few years. Of our membership, almost 48% of them have joined. And these are the other, not lifetime members, but just the members, that group. 48% of them have joined us in the last 4 years. So I find that that's really exciting. But on the other hand, we've had a lot of folks that have been with us for a long time. And while we didn't start keeping our membership records until 2006, there have been members that many of them have been members for more than 20 years. So I just think this is really exciting. I'm glad to see us continue to be a strong organization and hope that we look at opportunities to grow our membership in the future. Again, thank you to all our members and for their service and support of the organization. Next slide, please. Now this gets into the boring stuff, so I apologize. I'll try to make it go fast as possible, but I wanted to let you know our fiscal year for the network is January 1 to December 31, and we operate on a cash basis. And what that means is we only count revenue and expenses when they actually occur. What you're looking at is our financials through October 31st of 2021. Our budget for this year, and this was approved by our 2021 board, was $18,000 roughly, and we were expecting expenses around $16,000. Currently, we've actually had revenue of about just over $11,700, and that is mostly generated by our dues. In fact, 91% of that revenue has come from our dues. One of the things that has impacted the projection this year was we lowered our dues from the what was approved in 2020 at $100 per year to $75 this year. And just as a reminder, our dues actually don't coincide with our fiscal year. They run from July 1 to June 30. Also, in addition, as we've had to watch lower revenues, we've trimmed some expenses, but we have had some savings this year due to lower expenses with strategic planning, as well as website support. The organization's assets are all held in cash. This is our current cash balance as of the end of October. The board finance committee is evaluating policies on how to manage our cash, including coming with a policy for a minimum cash reserve as well as an investment policy. Next slide, please. The next 3 slides come from our IRS returns that we file every year, our federal tax returns. NBDPN has been very good about filing returns since the late 2000s. This is showing the last 10 years of our surpluses and deficits. We work very hard to be judicious with our spending. The years that we have good surpluses are the years that we have annual in-person meetings outside of DC. When we typically have meetings in DC, we either lose money or break even. Next slide. Again, this slide comes from our EZ 990 tax returns, and this shows a fairly consistent and standard growth in our fiscal year, end of the year assets. So we've been fortunate in good management and being able to maintain and grow these funds. Next slide. Lastly, I just wanted to break out and show folks where our money comes from. And of course, the years we have the in-person meeting, that again is a big source of our income revenue. However, our members really do support our organization. Our operating expenses, our basic operating expenses are all covered by our dues. And we really think that that's, we want to express our thanks to our members for being here and supporting us. And I just want to summarize by saying, I think the network has experienced steady growth over the last few years, and this has been done primarily through judicious use of our resources. So thank you, and if you have any questions, please direct them to the chat box. Thank you.
Great. So I am going to ask Kim to stay on. Kim doesn't know about this, but Kim has been way more than a treasurer this past year. And so I really want to acknowledge the incredible hard work she's done, not only as treasurer, but as everything else. She's really kept things running. She's been a fantastic member of the board, doing way more than her share. And therefore, this year, I'd like to present her with the President's Award.
Well, thank you.
Anyway, it's here with your name on it. It says the President's Award 2021 presented to Kimberly Hauser, MBA, honoring an NBDPN member who has made significant contributions important to the mission and goals of the National Birth Defects Prevention Network, November 17, 2021.
Thank you.
So no one has worked harder. It was a unanimous decision of the board. We did it sneaking around you, and so we're so grateful for all the wonderful work that you've done. So thanks so much, Kim.
You're welcome, and it has been my pleasure. This is an organization that, I put it this way, I have valued it every year that I've been a member and been involved. Thank you.
Yeah, thank you. And I'll be putting this in the mail to you. So
thank you.
Thank you. All right, next slide.
Congratulations, Kim. Very well deserved.
Thank you.
So this is just everyone a reminder that our in-person NBDPN meeting is planned for March of 2023 in Atlanta, and we would love to see you there. If you've never attended, this is the only such meeting for birth defect surveillance professionals in our field. It's a great opportunity to network, to connect with others, make friends, and importantly, learn about this field. So please consider putting this on your calendars and reserving this time, just knowing this would be in Atlanta, and consider joining the National Conference Work Group that is doing such a great job to help plan for this. So just wanted to make sure this was on your radar. Next slide, please. Okay, so now we want to share with you a very exciting opportunity as we roll into the new year. So just recently, with the hard work of Kim and others on the board recognized that the network needed support as well as a long-term growth and sustainability plan. So CDC connected the network to the Association of Maternal Child Health Programs as a potential partner. After they met, it was immediately clear that our work aligned with each other's, and there were so many points of collaboration. So last spring, we applied together for CDC funding to support this work and have exciting plans for the upcoming year, which you're about to hear more about from AMCHP's new CEO. Next slide, please. So it is my pleasure to introduce Terrence Moore. He's the Chief Executive Officer of the Association of Maternal and Child Health Programs, also known as AMCHP. He has a long career in managing the nexus between organizational management and human rights advocacy for racial, sexual orientation, and gender equality. Prior to joining AMCHP, he worked for more than 15 years at the National Alliance of State and Territorial AIDS Directors. In his capacity as acting executive director, he managed domestic and international programs in Ethiopia, Haiti, Jamaica, and South Africa. He has served the political and nonprofit spheres in progressive leadership capacities and has excelled in working with partners, formulating advocacy strategies on key issues in health and maintaining a superior understanding of the U.S. Congress, federal agencies, and strategic partnerships. We are very excited to be entering into this collaboration with him and AMCHP. So with that, I will hand it over to you to share more about AMCHP and our planned work together. Thank you so much for being here.
Good afternoon, everybody, and thank you so much. Thank you, Vanita, for that warm introduction. I just want to check to make sure everyone could hear me okay?
Yes.
Excellent. So as a quick background, I just want to thank everyone for joining today, and we're excited about this partnership. Next slide. As a quick background on the Association of Maternal and Child Health Programs, we are a national resource partner and advocate for state public health leaders and essentially others working to improve the health of women, children, youth, and families, and that also includes those with special healthcare needs. Our mission is to lead and support programs nationally to protect and promote the optimal health of women, children, youth, families, and communities. And like NBDPN, we are a membership organization, and our core membership comes from the Title V MCH and the SHINS programs at state and jurisdictional health departments. And so I just wanted to share that while our organizations work to serve the core membership, we also work with stakeholders in MCH from other partner organizations, as well as academia can be members of AMCHP too. Next slide. So what is Title V? A little bit about Title V in a nutshell It is the legislation that provides a funding stream to states and territories for work improving maternal and child health. And so this is a little fun fact. It's the longest standing public health legislation in US history, and it's the only program focused solely on improving the health of all mothers and children. The Title V appropriates funds to states and territories to do a range of activities to ensure the health of our nation's mothers, children, and families. And so some examples of that are ensuring access to quality health services, promoting the health of children by providing preventive and primary care services, and also promoting family-centered, community-based, coordinated care for children with special healthcare needs. Next slide. So as Vanita mentioned, there are many ways in which the work of AMCHP and NBDPN and our respective memberships align, which is why we are so thrilled about this new grant. AMCHP and NBDPN have a long history of working together to support partnerships between the Title V programs and birth defect programs. So this marks an important opportunity and dedicated resources to build upon our prior and current work to improve systems for prevention strategies, our core surveillance activities, referrals, care coordination, and support for children with birth defects and their families across the lifespan. And to borrow a phrase from one of our early childhood collaboration projects, we see opportunities as the, quote, art of the possible, and realizing the power of what we can achieve by working together and committing to coordination and alignment across programs. So I'd like to thank the AMCHP and NBDPN teams for many efforts to make this opportunity a reality, and to our funders, of course, at CDC for their continued support of our programs, for their vision, and for valuing and investing in this collaboration. There are a lot of activities on the horizon to promote collaboration and intentional alignment between Title V and birth defects programs, and their support of our two organizations in this partnership. So I'd like to highlight a few for now. Next slide. So here are some examples, and these including the current landscape of collaboration between Title V and birth defects programs, to better understand how Title V and birth defects programs are currently collaborating, the barriers and opportunities for collaboration, the organizational capacity of Title V and birth defects entities, the impact of COVID-19, the world in which we are now living within, and the capacity and collaboration between those indices, and other factors related to the current state of the state as it relates to collaboration. And so we'll analyze what we find to identify both facilitators of collaboration and opportunities to improve strategic alignment, best practices and policy, and emerging issues and priorities that are prime for collaboration between our respective programs, as well as AMCHP and NBDPN. And so ultimately, this will inform resources, the technical assistance that will support collaboration at the state level and build our workforce capacity. So we'll also be laying the groundwork for strategic planning for the network and for our collaboration, as well as sustainability and growth for NBDPN. We'll be working with the NBDPN board and committees, and we are thrilled at looking at existing data and resources and the best ways to get input from all of you to inform this important effort. We'll be reaching out over the coming months and look forward to engaging with you all. Next slide. So finally, we've been setting up the AMCHP team and dedicated resources to support this partnership. And so this slide shows the key AMCHP team that will be supporting this work. Get familiar with the names and the pictures you see. We look forward to meeting with all of them at some point. I just wanted to point out your main contacts will be Kate Taft, our project director for this grant, and Sabra Ackner, the technical advisor. We're also hiring for a full-time program associate to be your NBDPN liaison and to provide support to the network and this grant. Next slide. So you can see there are a lot of exciting opportunities to come, and we very much so look forward to partnering with all of you on this effort. And if you have any questions, please don't hesitate to reach out to the AMCHP team. We have an email also set up where you can connect with us directly about anything related to this work, NBDPN at AMCHP.org. I appreciate this opportunity to meet with you all today and our plans and hopes for this work together. Thank you very much.
Great. Thank you so much, Terrence. We're all so excited about the work with AMCHP and the support that we're hoping that you can provide to our committees and to the board. We think it's so important for us to be working together. Next slide. So now we're going to move on to some committee and work group updates. And as I mentioned to you, these committees and work groups have been working very hard over the past year. And as you all know, this has been a tough last couple of years in the middle of a pandemic, not able to see people face to face, but these groups have not slacked off at all. They've been working really hard. So the first one, next slide, is going to be Diana. I see Diana there, ready to go. So the Program and Professional Development Committee.
So I'm Diana Contreras. I am the manager of the Birth Defects program in Arizona and the current committee chair for program and professional development. And I really appreciate the opportunity to be able to share a little bit about our committee. The purpose and mission of our committee is to engage our members and foster community connection and growth, both of individuals and of the network, through conferences, programs, and other professional opportunities as they arise. Next slide. We currently have 4 work groups under our committee. They're pretty self-explanatory, but I will go into each a little bit more as we review some of our past accomplishments and future plans. Next slide. So one of our biggest goals and accomplishments over 2021 was really restructuring these work groups to better align both with the vision and purpose of the network and to make our committee run a little bit better and work together across our work groups. So our first work group is the membership. And this really is focused on the member benefits to you. We are always open to ideas and comments and feedback as far as what's going well and what you would really like to see from the network. We want this to be beneficial to all of our members and really look for those opportunities. A couple of the things that we did do this year were revamp some information about the membership and about the member benefits. A new member welcome orientation was developed, and that will be happening immediately following this meeting. We invite anybody who is a new member over the last couple years, and really anybody who wants a walkthrough of the website to better understand the value and the benefits of membership and to just get a little bit more familiar with our network. We know, as Dr. Rasmussen mentioned, it's been a challenging year and not everybody has engaged the same way we normally would. So please feel free to stay on this call if you're interested in that orientation. We're also in the process of collecting more resources for our members. That was some feedback that we received over the summer. We want to have a resource section on our website. An email did go out requesting those resources. We're looking for things like SAS code that's used across programs, job descriptions that are unique to our field, but very similar across programs. We'll be sending that out again, but feel free to submit any resources that you may have that you think may benefit your peers, and also look for those resources on the network. Diversity and inclusion was developed as a response to a lot of the events happening over the last few years. NBDPN really wanted to make sure we were engaging our entire community, our entire network, our entire membership. The first accomplishment or first act and then accomplishment of this program was really to conduct a survey of our membership. We needed to understand both the makeup of our membership and the needs. So a survey was conducted and a report was developed from that. And now we're really working on those overall goals for that network. What will move this network forward in the next few years? And really, we want this work group to be a support to all of the rest of the network, to make sure we're consistently engaging our entire membership and showing inclusivity across our network. The next one was previously mentioned by Vanita, National Conference Work Group, previously called Annual Meeting. We did have a 2020 in-person meeting in Washington, D.C., which was a great success. And we are looking forward to that 2023 meeting in Atlanta in March. So again, put that on your calendars and watch for information coming up. The final work group in our committee is a professional development and mentoring committee or work group. And this was developed really in response to our shift from an annual meeting to every other year in-person meetings. We want to still make sure that we are engaging our membership and our network. We're partnering with other organizations and providing something to the community related to birth defects. We do have a webinar coming up December 2nd. Watch your email for that. Information will be coming out very soon. That is part 2 of a CCHD webinar in partnership with APHL. And we're working on developing a stronger mentoring program. If you remember a few years ago, we had some different types of meetings with program managers and peer support, and we really want to make sure we're mentoring both our younger professionals and the people that have been in this network for a long time, helping them to further engage with each other. Next slide. 2022 plans, I covered a few of them, but first is with regarding leadership. Sam Biner-Brown will be joining us as co-chair. We look forward to that. She's been involved in several of these committees and will definitely help strengthen our program. Membership, again, we really want to continue focusing on those member benefits. Please provide any feedback or comments that you have. And again, look for that request for resources. We really want to develop some tools that will be valuable to our membership. And we can't do that without the people currently working in this field. Professional development and mentoring, we are working on a number of additional webinars coming in 2022, CCHD Part 3, a session on neonatal abstinence syndrome and related surveillance, as well as some data sessions, and then moving forward with our mentoring program. And once again, because we can't mention it too often, we're currently working on those plans for the meeting in 2023 in Atlanta. We're very excited. We have a great program already, and we'll be looking to add to that in the next few months. Next slide. These are the current leads of our work groups. And as you see, we have some spaces. We're always open to more support. Any ideas you have to support what we're doing. You can be a short-term participant in some of the immediate work, or certainly long-term working on some of those overarching goals. We always welcome feedback, workers, support in any of these work groups. So thank you so much for letting me share about our committee.
Great. Thank you so much, Diana. Thank you for all of your hard work and the work of your committee. The next speaker is going to be Dominique, and she's going to be talking about the Surveillance Data Committee. Dominique?
Hey, thank you so much. I'm very pleased to be able to chat with everyone today. For those who are newer, just want to share that the Surveillance Data Committee we work to do is to promote and facilitate the utilization of state birth defect surveillance data with the goal of advancing knowledge through, the ability to pull data, resources, and knowledge so that we can get the best information available on these rare outcomes. All right, next slide. So as part of that mission, a lot of our work revolves around doing multi-state analyses of birth defect surveillance data, which are provided by our member surveillance programs. So I want to highlight a couple of the publications that have resulted from these multi-state projects in the last couple of years. So we just recently had a paper on the prevalence of birth defects by interpregnancy interval was recently accepted at Birth Defects Research, and that is now available on the website there. And that paper was a long time and a lot of work coming, so we're really thrilled to see that out and available now. We've been working on annual spotlight papers, which are now standalone papers separate from the special issue data tables. And so these have been essentially independent analyses that have been produced. So in the last couple of years, so we've had a couple of papers on Down syndrome that we've worked on, and we looked at co-occurring both updated prevalence estimates as well as co-occurring defects by maternal age and infant sex. That one was published last year. And then a paper that we have submitted is on looking at co-occurring defects by race and ethnicity. Additionally, our current spotlight paper that we've been working on looks at the co-occurrence of congenital heart defects among infants with critical congenital heart defects. And that one has been submitted as well. We also have updated state data tables and directory information coming. That should be posted on our website as of January. It should be pretty soon with the special edition of BDR. And we are hoping that we can get those into a format that'll be a little more user-friendly than just one giant PDF, although that will still be available for download. And then I just wanted to highlight, because this committee work is in no way mine alone. This is a large committee with a lot of wonderful people who've been doing a lot of wonderful work for a long time. So I want to just highlight how valuable that work has been to the birth defects community, just by showing how well cited many of these papers are, and that this work is really making a contribution in this field. Next slide. So our plans for 2022. I am very happy to announce that Irini Nestoridi will be taking over as chair of the committee. And as part of that, Joy Shan, who has been our wonderful co-chair, will be stepping down, and I will take over the vice chair as temporarily while we get transitioned. We are working on not only doing the multi-state project, but we're working on some resource development to try to facilitate further multi-state studies, as well as to support our individual state programs. So that includes contributing relevant information to the resource sharing that was discussed earlier. And so we have some contributions of templates, and I believe some SAS code and other things that are going in. We also are working on the development of guidelines, management tools, and other information around the multi-state projects to try to facilitate their development and management. These are really massive undertakings. If you just think about dealing with the IRBs of 10 different states, you start to get the picture of where some of our challenges lies, let alone dealing with small data quirks and what have you. So we want to take some of the lessons that we've learned and really be able to pull that knowledge together so that we can make this as easy as possible, knowing it's always going to be a challenge, but a challenge that's worth it. Along those lines, we're also exploring options for housing, utilizing, and maintaining multi-state data in a format that would be cloud-based and would allow multiple analysts to work with the data rather than housing these projects within a single center and then only having one or two analysts who can commit time to that. So hopefully that would allow more flexibility and allow us to do more projects and learn more stuff. And finally, as far as resources go, we're looking at the development of data access and visualization portals. This is in collaboration with the March of Dimes and CDC to help make our data more accessible to the public and to put it in visual formats or queryable formats that will allow people to get more information about more access to surveillance data on birth defects through the network. We have several ongoing multi-state projects. The folate fortification and spina bifida lesion level project has produced a manuscript, which I believe is going into CDC clearance or is currently in CDC clearance. That one's led by Kara Mai and Russell Kirby. Turner Syndrome Project, which is being led by Angela Lynn and Philip Lupo, has got data and is continuing to gather data from several different states, but we believe that there will be some preliminary data available in the spring. The mortality among infants with birth defects, or maybe I think it's infants and children, so that's being led by Wendy Nemhard. It is also another large undertaking, which we are very grateful that she has been willing to do. We're also interested in looking at preterm birth risk, which is a new project, and that one is currently being led by Ann Davis. And finally, looking at birth defect surveillance across the lifespan. So this is a working group to try to gather ideas about how we might be able to do that. What are the barriers and facilitators of this work? And Vinita Leadham is working on that. Next slide. Finally, I'd like to ask folks to come join us in our work. So we are looking for some leadership on those, on a work group for the biennial reports to help us, figure out what information wants to go in there, and guide some of the spotlight papers and what have you moving forward. The multi-state project is currently being chaired by Rebecca Lieberman, and we're grateful for that work. We're also looking for leadership and members for a group on the development and maintenance of this data repository or cloud-based data holding. And again, we'd also love a couple of representatives in this work with the March of Dimes and CDC on developing data portals for access to birth defects data so that we can make sure that we are meeting the needs and concerns of states in the process. So thank you very much.
Great. Thank you so much, Dominique, for the hard work of you and your team. Fantastic work. Our next speaker is going to be JP Tanner, and he's going to be talking about the Surveillance Guidelines and Standards Committee. JP.
Thanks, Sonia. Yeah, my name is Jean-Paul Tanner. I am the chair of the SGSC along with Nina Forestieri. Next slide. So first, let me give you a quick introduction about this committee. So this committee discusses and conducts activities on certain topics, and they include things like developing and enhancing tools that are going to facilitate birth defect surveillance. In the past, we've explored issues with coding and coding systems. So for example, the ICD-9 to ICD-10 transition. Another topic is the development of and implementing and evaluating data quality. So for example, the development of the nationwide data assessment tool that was done a few years ago. And now we're looking at ways how we can improve that data quality assessment tool. And another topic is how we can use electronic health records to facilitate birth defect surveillance. And as you can see, all these activities are led by work groups. And so I want to thank, first of all, the leads of all these work groups who are listed on the slide, because without them, obviously none of this work would be possible. So these are all our work groups and the work group leads. Next slide. And so we've had a number of accomplishments in 2020 and 2021. So these are just some of those examples. So the technical tools work group during the 2020 NBDPN conference, they performed an in-conference training that discussed common challenges among birth defect abstractors. They're currently working on a pre and post abstraction webinar, which was going to discuss the ins and outs of what goes on before going to abstract and then after performing data abstraction. The Electronic Health Records Work Group has collaborated with Altarum, which is a nonprofit research and consulting organization that I believe has worked with a number of states on HL7 messaging and EHR activities. So they collaborated with Altarum to create electronic birth defects specification reporting standards. They also participate in a public health interoperability training group to identify and disseminate resources for electronic data exchange. Next slide. The ICD-10 work group maintains a timeline of ICD-10 CM changes, and that's available on the NBDPN website. And this year, with the help of CDC, we submitted and defended a proposal to revise the ICD-10 codes for ASD, and atrioventricular septal defect. And we expect those provisions to be implemented next year by CMS. The data quality and standards work group, they updated the data quality summary reports for all states. They created and sent a survey to NBDPN members to get their thoughts on adding data quality indicators to the current data quality assessment tool. And then lastly, we finalized drafts of the data utilization tool, as well as data quality indicators, and both of which are currently being piloted by a few states. Next slide. So next year, we've got a few plans that are in the works. The technical tools work group was going to finalize that pre and post abstraction training webinar, and that's going to be made available in the NBDPN website. They're also working on some condition-specific information packets, which is going to have information such as definitions, some visuals, some abstraction tips for selected birth defects, and these are just some of those birth defects that have been discussed for the information packets over the meetings. The EHR work group, they've been discussing and they plan to have webinars on topics such as introductions to interoperability. They plan to collaborate on interoperability advancements with vital records, and then they discuss how to better utilize electronic case reporting, obtain lessons from more advanced programs that have already had some progress with EHR and HL7 reporting. And discuss data system advancement to support interoperability and also assist with FHIR birth defects implementation guidelines. They're also going to work on developing a list of training and educational materials that are going to be shared with the birth defect community. Next slide. The ICD-10 work group, they're going to continue to monitor the ICD-10 codes for birth defects, so those changes in the codes. The data quality and standards work group, they're going to compile updated data quality assessment tool summary reports. They're also going to finalize the data utilization tool and the data quality indicators and then distribute those to all the program contacts. And then something that's not listed on this slide is that in 2022, we're going to organize the Surveillance Guidelines Committee, and they're going to be tasked with updating the birth defect surveillance guideline that's currently available in the NBDPN website. And then lastly, I will be stepping down as chair of the committee. I've been chair of this committee for about 3 years now. And Nina Forestieri is going to be moving into the role of chair. So we do plan to identify a co-chair over the next few months. And of course, we're always looking for new members to participate in our activities. So anyone is welcome to join. The SGSC contact information is available on the NBDPN website. So please feel free to email us if you're interested. We're welcome. We're always looking for new members to help out with our activities. Thank you.
Great. Thank you so much, JP, for your presentation and for all the work of you and Nina on the committee. Fantastic work. Our next speaker is going to be Amy Nance, and she's going to be talking about the work of the Communications and Health Promotion Committee. Amy?
Thanks, Sonia. Good afternoon. My name is Amy Nance, and I am the Utah Birth Defects Program Manager. And I also chair the Communications and Health Promotions Committee with Justin Hong as co-chair from Arizona. The mission of the CHP committee is to plan, coordinate, execute the NBDPN communications across committees, the membership partner organizations, families, and the general public. Next slide. Over the past 2 years, the CHP has accomplished many of our objectives. First, and probably the most challenging, was merging 3 committees from our old NBDPN structure, and those committees were the Publications and Communications, Education and Outreach, and the NTD Surveillance and Folic Acid Education into one large committee. I would just like to thank everyone who currently sits on our newly formed CHP for supporting Justin and I as we've kind of worked out all the kinks. So thank you. Secondly, the National Birth Defects Prevention Month campaign over the past several years has had the theme of Best for You, Best for Baby. This campaign overall was well received by many partner organizations and many states who have used the toolkit in their outreach within their states. We have supported the World Birth Defects Day, which for those who may not be aware is each year, March 3rd. This is in collaboration with the International Clearinghouse. The CHP with the Program and Professional Development Committee, as well as Sonia Rasmussen, the NBDPN board chair. We co-led a very successful members listening session, which we held in June. And as Diana mentioned, we learned that there was a need for those resources, so please send those in. The CHP has also created a new communications request form this past year to help facilitate better communication to the members. And that's either through email, website updates, or social media. And I would just encourage you, if you have something that you believe would benefit the network members knowing about, or if you would like your state to be recognized, please submit that information through the form. We'll post a link in the chat that's just been done that you can look at and submit those. This past year, in an effort to move, we made an effort to move Folic Acid Awareness Week from the second week of January to the second week of September. And so this past year, it was held September 12th through the 18th. And then lastly, our committee has taken on a greater role in the network's social media efforts by establishing a social media work group and obtaining a Hootsuite account, which allows us to post messages on all three of our social media channels, those being Instagram, Facebook, and Twitter. And I'll just make a shameless plug. If you are a social media person, please like, share, subscribe, and comment to our social media posts. Next slide, please. Our goals for this coming year are to create new materials for Folic Acid Awareness Week, which in 2022 will be September 11th through the 17th. Further develop the Birth Defect Awareness Month Toolkit, creating new materials and resources for states to use as they develop their campaigns in their states. The bi-monthly membership newsletters, continuing those. We are always looking to involve more of our membership in the committee. And so through taking on more leadership roles and in joining our work groups. So I would just really like to encourage anyone who is interested in communication to join our group. And to the program managers out there, if you have a health educator on your staff, please support them in joining the CHP committee because their skills are really beneficial. And then lastly, just ensure that we are present on social media and Instagram because that is the way we're getting most of those messages out. And so just continuing that effort. Next slide, please. Our committee has 4 work groups. This truly is where all the work happens. As a whole, our CHP committee does meet every other month on the 4th Wednesday. Our work groups consist of health observances, which we break into 2 work groups. So Birth Defect Awareness Month, which is in January, or the overall Birth Defect Awareness Month is in January, and that is led by Justin Hung of Arizona. And then our Folic Acid Awareness Week work group, as I mentioned, is the 2nd week of September, currently led by Barbara Fornoff of Minnesota. Our 3rd work group is our social media work group, which is led by Stephanie Glickman of Oregon. And lastly, our newsletter work group led by Rachel Dasquoth with the AAP. And I guess I would just say, if you think you're missing information from NBDPN and you feel like you want to know more, please again, consider joining the committee as we need your insight into what you would like to hear and how you would like to hear it from NBDPN. We really are just here to help our membership be better informed. So please share your skills with us. If you aren't able to join the committee, but you have some ideas, please email the email on the the slide, NBDPN_CHP@NBDPN.org, because we value your thoughts and insights and how we can become better and meet your needs. And now I'm going to turn it over to my co-chair, Justin, to tell you more about this year's Birth Defects Awareness Month campaign. Thank you.
Thank you, Amy. As Amy said, I'm Justin. I'm from Arizona. I'm the surveillance manager here for the Arizona Birth Defects Monitoring Program. I just want to say from all of us on the Birth Defects Awareness Month Toolkit work group, we're all very excited to announce the next iteration of our January Awareness Month campaign. We have officially shifted the language for this campaign, and it was prompted by our CDC partners. You'll notice that instead of Prevention Month, we're calling it Awareness Month now. Awareness and prevention go hand in hand, though some members have shared with us before that prevention sometimes carries a negative connotation. So making this shift kind of allows for discussion beyond prevention, and importantly, because following all of the prevention tips that we do have in the toolkit, it's not always a guarantee to be birth defects free or whatever. With the more inclusive language, we're also hoping to reduce some of the stigmas, and it will also hopefully allow us to link to our partners that address more of the life course perspectives for caregivers and those living with birth defects. Next slide, please. So with the new name, we also have a new webpage and a new theme. It is Healthy Communities, Healthy Babies. There's a screenshot of what the website hopefully will look like once it's actually finished and live. The 5 prevention tips will have mostly stayed the same as tips in the past, though we did make additional tweaks to the language to continue our efforts in stigma reduction. You will still be able to download the content, all the content in one PDF if you want to. That is where the blue background 5 prevention tips for healthy communities and healthy babies, you'll be able to click on that to download the whole PDF. But we'll also have each individual tip as a separate PDF to download by clicking on the image below, if you choose to focus on one specific topic instead of multiple. On the new website, you'll be able to click through each of the 5 tips and the proclamation and the sample newsletter. And if it's all working right, I really hope that there's going to be a really short preview of, like an abridged version of what's in the PDF content right next to that white space right there. All of the image variations that we have, there are a good number of them. They will also be available for download somewhere on this website too. A special note, I would like to say the proclamation is finalized. We should be sending out a link to that because it might be prudent to check with your governor's offices to see what the timeframes are if you are planning to have a proclamation ready to go in January. So as part of the tweaks in the language, our new theme also begins to shift some of the focus from individual action to include aspects of the community that are extremely valuable to individual success. While each of our 5 tips mostly seem straightforward, when we think of the social determinants of health and consider what kinds of barriers exist that prevent people from achieving each tip, then we kind of realize there are more ways that we can improve upon the information that we're providing during the Awareness Month campaign. So tip 2, for example, asks individuals to book a visit with their healthcare providers, but what if you don't already have one? It's hard enough to find or decide on who your PCP should be if you have insurance. Where do you start if you don't have insurance? Next slide, please. So our initial attempt to address these gaps is to introduce this new resource. It's to collect a bunch of local community resources into this map that will be embedded on our website. I think you just scroll down a little bit if all is working correctly. This is the quick reference. There are 3 areas I would like to direct your attention to. Is that all of the pins can be clicked on, and when you do, it will provide additional information and a link to that local community resource. In the top left corner, there is a small little box with an arrow in a white space. When you click on that, it will open up a menu with a full list of the resources, and it's organized by tip and the associated pin color. So each of the 5 tips has its own pin color. And to see a larger version of the map, which is probably more recommended, at the top right section of that map, you'll see like enlarge icon. That will take you directly to the Google My Maps. And when that's opened up, if we hit advance real quick, this is the view that you'll see, and it's a little bit easier to navigate. One special note is that not all of the pins are actually physical locations. Some of them are to state websites, state health department websites, 211 resources, or other like online sign up web form type things that are very important resources to use. Okay, next slide, please. So what kind of resources are we looking for the map? We really need your help to fill this map in more comprehensively. And these days, a map's main purpose is to have pin locations so anybody can quickly gauge their proximity to said resource, right? And as part of the toolkit work group, we really struggled with this process because a lot of the links that we provided were for online resources that only contained textual information and not really specific to how to access this resource or care. And while those links to like health department immunization websites are very important to include, a normal person who's looking to get immunized is not likely to get a vaccination at their local public health admin office, right? So how would we even pin that type of web page onto the map? Hit next, please. So not all resources are created equal. We are hoping that all the pinned locations keep in mind that we do have an end user target audience that we're trying to reach. And that is people who are planning to get pregnant or currently are, and they're also trying to follow our 5 prevention tips. So all the pins on the map should be specific to local communities. They should live on how to access the resource, and have appointment schedulers, web forms, whatever else, and contain the physical address of where the resource is. Next slide, please. So just an example of some Arizona resources. That first link right there is the state health department link that I think most of us would actually send to most people, right? But when you click on that page, it ends up taking you to a really general informational page that is sometimes a lot to read through, and you have to, scan a lot to find link number 2, which is actually the vaccination campaign. And then from there, you have to go to link number 3, which includes a list of places and other programs that you can actually go to. Finally, you hit link 4, which contains all of the actual information, an address, additional forms, everything that a regular person would need to go and access that resource. I threw link 5 up there because from link 4, you have that sign up calendar that has appointment slots directly on there, which is really nice. And so on the map, I have tagged that specific immunization clinic for Arizona. Next slide, please. So we definitely need more help to fill out this map more comprehensively. If you go look at the map once it's live, you'll be able to see that there are a bunch of resources tagged already for folic acid. Every state, almost every state, has at least one pharmacy that is participating in a free vitamins distribution program. It is really overwhelming and a tedious process to sift through a bunch of specific locations, especially without some kind of idea of proximity to an individual's life or work or home. But I'm hoping that as members of our own respective communities, we at least have some ideas of what parts of town might have more traffic, where is more accessible, that kind of stuff. So hopefully we can come up with a much more comprehensive list to completely fill out the map. We're also asking and hoping that members of the general public will follow along and engage in our social media platforms and suggest their own resources that they've used to access some of these, to achieve some of these tips. There are a couple of examples here of things that I pulled into Arizona's map section. You're free to click on those. Sorry. You're free to click on those as they relate to each tip. Next slide, please. So as part of the shift in the language and our naming convention, it does allow us to more easily link to our partner organizations work. So for CDC this next year in January, this is a list of some of the topics that they're planning to focus on for their digital toolkit during Birth Defects Awareness Month. That's all I have for the update for today. Thank you so much, everyone.
Great, thank you so much, Justin. Again, you'll see how much work has been done by these committees and work groups this past year. It's been incredible. And I'm excited about the new Birth Defects Awareness Month. So next slide. So I think this is going to be Philip. I can't remember who is going to present about elections. Yes, okay, good.
Thanks, Sonia. Yes, so I get the pleasure of talking about the elections for the 2022 board. Next slide. Actually, it's 2022 rather than 2021. Sorry about that. Even though it is 2021, this is for next year. So exciting note that voting actually starts today at 5 p.m. Eastern. Just as a note for those of us who aren't in the Eastern time zone. You should be getting an individualized link via email. Several of us, for whatever reason, have had troubles receiving those emails. So if for some reason you don't have an email in your inbox tomorrow morning to vote, please email us at nbdpn@nbdpn.org. It's obviously something that we want every member to take part in. So again, if you don't get an email with the choices for the election, please let us know. The voting will be open until midnight, November 24th, 2021. And I think we have a really exciting ballot of 5 individuals that I'll talk about here in a moment. In terms of voting, everybody should rank the 5 candidates from most preferred to least. I know it's going to be challenging. If it were my choice, I would elect every member here to the board. But as our bylaws state, we have 9 members on the board, and these individuals will be replacing 3 individuals who are rotating off this year. The website election module uses rankings to choose the 3 candidates for the board, and results are going to be announced on Tuesday, November 30th by email and also on the website. Next slide. So let's talk briefly about the candidates. If we had more time, we would have each candidate give us an indication of who they are, but I think a lot of us know them, but we also had them provide answers to a few key questions, just so you can get a better sense of not only who they are, but their motivations. So next slide. First of all is Amanda Elmore, who's affiliated with the Florida Birth Defects Registry and also a PhD student at the University of South Carolina. She's a data manager in Florida, and again, also a candidate for the doctoral program in epidemiology at the University of South Carolina. She's been involved in the NBDPN for 4 years, and in that time, she has served as the Secretary-elect, the Secretary-Treasurer, and also the annual meeting workgroup chair. The last thing we asked each of the candidates to do is give a sentence about what the NBDPN means to them. And for Amanda, she wrote, "To me, NBDPN is a community and network that supports birth defect research and surveillance, not only through promotion and education, but also by supporting the public health professionals who do the work." Obviously well said, and I think rings true for all of us. So next slide. Brennan Martin, who is currently in the Vermont Department of Health and coordinator of the Vermont Birth Information Network, has been involved in the NBDPN for 10 years. He was the member at large in 2019, and he's also been very active on the data committee. When I was chair, he was there faithfully taking minutes for every meeting, and again, a real active member in the network. In terms of what the network means to Brennan, he wrote, "The NBDPN is the best vehicle for birth defect surveillance programs and researchers in that field to agree and disseminate best practices, cooperate to conduct research, and to develop the next generation of professionals in the field. Vermont is such a small state that participation in this organization is the best way for it to make a difference. But I believe that for all states, participation in the NBDPN makes us all much more effective than operating in isolation. Again, these are amazing comments that we're getting from candidates, and I couldn't agree more with what Brennan wrote. Next slide. Amy Nance, who obviously everybody knows from her previous presentation in our meeting today, but also because of her involvement in the network. She's been affiliated with the Utah Birth Defects Network and is also the program manager of the network in Utah, and has been involved in the NBDPN for 20 years now. She has served as a member at large, the secretary treasurer, and is currently chair of the Communications and Health Promotion Committee, as you saw. And in terms of what the network means to Amy, she wrote that it means collaboration. NBDPN has given me the opportunity to build relationships and work with so many amazing people in the field of birth defects that I just wouldn't have been able to do without this organization. So again, I think a testament to the impact of NBDPN in building the kinds of collaborations that we all find not only satisfying, but also important in the work we do. Next slide. Jody Snow, who's with the Illinois Department of Public Health in the Adverse Pregnancy Outcomes Reporting System, and is currently the manager of the Biomedical Coding Unit, which means she is manager of the abstractors in Illinois. She's been a member of the NBDPN for 4 years, and in that time, she's been very involved as a member of an array of committees, including communications and health promotion, and also surveillance guidelines and standard committee, where she's been a member of the standards work group, the HL7 work group, and also the technical tools work group, where she's currently co-chair. So Jody's obviously been busy and has been an amazing member of the network. In terms of what the NBDPN means to her, she writes, I believe we as a group have the ability to make a difference and stop or at least ease the burden and struggle on parents and babies by our collective actions and work. And I think that's a great reminder that for those of us who tend to focus on our research, again, a reminder that this work impacts the lives of so many beyond this. All right, next slide. Amanda St. Louis, who's affiliated with the New York State Department of Health Birth Defects Registry. She's currently the deputy director and a research scientist too. She's been involved in the network for a little over 7 years. While she hasn't been formally involved in the network as a committee lead, she has participated on various committees over the years, and recently spearheaded, I think, a particularly important effort in trying to update the ICD-10-Q-211 code to impact the surveillance of ASD and PFO. And this was, again, an important effort that Amanda was dedicated to moving forward. In terms of what the NBDPN means to her, it's a way to accomplish and grow more together as a community through shared knowledge, data, and support. And then next slide. That's actually leading us to our Q&A. So I think it goes without saying we have an amazing slate of candidates. You'll get your email hopefully this afternoon, if not tomorrow morning. And if you don't get that email, please email us at nbdpn@nbdpn.org and let us know. That individualized email will allow you to rank the candidates, and from that we'll select our next 3 board members. All right, any questions?
Yeah, I was thinking we might not be able to get through everything because we had a jam-packed agenda, but we do have a few minutes for questions. If you want to put a question in the chat, we'd be happy to answer them. In the meantime, I do want to say how incredibly positive I view the future of NBDPN. partially because of the great work of the committees and work groups that we heard about today, because of the exciting new collaboration with AMCHP. As many of you know, National Birth Defects Prevention Network has primarily been a volunteer organization, really totally a volunteer organization with some incredibly dedicated volunteers. But I'm excited that now we're going to be able to have some people working with us at AMCHP who are going to be able to help those committee chairs and work groups, and we're really excited to be working with them. We have so much overlap with AMCHP. We all care about moms and babies, and I'm looking forward to working with them together. And then I'm also really excited about the candidates for the board. It's really wonderful to see those candidates and their enthusiastic statements about what the NBDPN means to them. So if there are questions, we'd be happy to answer it. Otherwise, we can move on to as you remember, the next thing is a new member orientation that'll happen immediately after the meeting. So I don't see if there's questions in the chat. I haven't been following it.
Not yet, but we can give people a minute. Some of them might need it.
Okay, the other
to formulate.
The other thing I did want to say at the end is again to congratulate Kim Hauser for receiving the President's Award. I can't imagine anyone who would be more well deserving of getting that award. So thank you so much, Kim, for all your work over the past year and the past many years that you worked on NBDPN.
Thank you. Thank you very much.
All right, looks like people are pretty quiet with the questions out there, but I see that most people stayed to the bitter end. So that's also wonderful to see the interest from the membership. All right, well, you'll be looking for that voting email overnight, and please vote. And we want to have a board, the enthusiastic kind of board that we've had for the past year. And please feel free to email me if you have any questions that weren't answered on this call today. So, great. Thanks, Barbara. All right, well, we'll end this meeting and we're going to start the membership orientation. I think we'll just start it a little bit early if all are okay with that. AMCHP is going to do a recording of the membership orientation. So in case there are new members that join later on or people that couldn't attend today, we'll make that available on the website. So, all right, thanks so much, you guys. Bye-bye.
Hi, everyone. My name is Maria Plitis. I'm a postdoc at Mount Sinai in New York City. I've been a member of NBDPN for a couple of years now, and I am the chair of the membership work group. So we just wanted to put together a new member orientation, and even if there are members that have stuck around, just to give you a refresher on what NBDPN is and our revamped benefits that we have been working on. So NBDPN, as you know, we all know, it was founded in 1987, and it's made up of a bunch of different people, epidemiologists, people in academia, public health officials, both from state and local levels, including parents as well. And we all have a commitment to understanding factors that may lead to birth defects, and as well as identifying strategies for reducing birth defects and also serving the needs of the children and families that are affected by birth defects. So the mission and the goals of the network, you know, we want to establish and maintain a national network of both state and population-based programs for birth defect surveillance and research. And the goals are to improve access to and information on the prevalence and trends of birth defects, increase collaboration, and also advance science through birth defects surveillance and its applications for health efforts and resource allocation. So how do we accomplish all of these goals? This slide just shows a little bit of what NBDPN does to accomplish those goals. And we all saw a little bit during the meeting how these are done, improving the quality of surveillance data, identifying factors to be used for primary prevention strategies, things like that. And this is all also done through our committees and our work groups. And as we all heard, we have the 4 committees with the different work groups of each. I have included the email addresses for each of the committees and when each work group meets. So if you feel like you would be beneficial to a work group, please feel free to email the committee chairs and get added. Even if you have questions about specifics on what they do, they will be helpful in answering your questions, and we hope that you join a work group. One of the main things that the membership work group has done this year is really take a deep dive into our benefits. We want all of our members to know what their benefits are and make sure they're getting the most out of being a part of this network. So we do have general benefits that are available to all, and then we also have member-only benefits. So as Justin had mentioned on the Birth Defects Awareness Month, we will update that in the benefits. We have the toolkit, we have access to birth defects surveillance guideline and standards. Obviously, we have our national conference that has been mentioned. And we also have collaborative webinars and studies as well. However, some of the member-only benefits include a discount for that conference, member-only webinars, a mentorship program, a members-only section on the website, which I will take you on a small tour after this slide. And it just contains a bunch of resources for both state and population birth defects registries. We currently have a call out for resources that we can continuously add to this section. There are also notes and resources from past meetings, on-demand webinars. There is a directory of NBDPN members for networking if you want to reach out to someone from a different program. And there also is going to be a new forum and chat section on the members only website to discuss with other members. And again, as a members only benefit, participation in the work group so you can support NBDPN's mission. So if you go to this website, you'll see here the website. If you scroll down, you can log in. And this will take you to the member menu. As you see here, this will have your information. And if you go to the member and member name search, you can search by a name, or if you can't remember but knew that they were from Georgia, for example, you can search the specific state and individuals will pop up. If you go to the members area tab at the top and click on analytic resources, here you will have come to the resources page where we have different resources. For example, we currently have SAS code, we have data presentations, and this is the page that we are looking to update. So please, if you have any resources, please send them to membership@nbdpn.org. So we are constantly looking to update this with new resources. If you go to the meetings and previous annual meetings, you can see resources here, as well as if you go to the 2020, there are slides from this past or the 2020 meeting that are available for viewing as well. So we really want people to know that this exists and that this is here for your resources. So again, if you also go to the webinars, we have the Follow the Blood webinar, which is a great webinar that is on demand for our members, as well as a few other webinars as well. So again, if you know of someone who also wants to join, if you click on this join now under the member login, it'll take you to join NBDPN. And if you guys have any other suggestions on how to improve the website for the members only section, please let us know. Or if you have any resources, please let us know that as well. So again, here is the email for the membership at nbdpn.org. We just wanted to keep this brief and let members know what their benefits are and how we are here to help provide resources and things that are needed for the members. And again, if you have any other questions, please email us at membership@nbdpn.org. Thank you so much.
Thank you for sharing all that, Maria. We can wait if anybody has any questions. Some of the website wasn't showing up, Maria, so I don't know, since we were early, if you want to kind of click through that a little bit again. It was showing the link, but not the website.
Oh, okay.
Yeah, but obviously we can stay on too for a few minutes in case anybody has questions and or wants to chat a little bit about some of the site.
Can you see the website?
Yes.
Okay. Yeah, I'll just quickly go through it again. So when you log in here, again, this is the member menu. If you go to the member search here, you can search by name or search by state. And then if on these tabs up here, the members area, if you go to the analytic resources, here again is where you will have your resources such as your SAS code. We again have received a few resources, so we will be updating this page as we get more and more resources. And if you go to the bottom webinars, here we have the Follow the Blood webinar and a couple of others that are on demand. The meetings tab, if you go to the 2020 meeting, it'll have slides from the previous in-person meeting, and we will update again once the next meeting occurs. Here are on this resource tab, these are available to everybody, so not just members, but the general public as well. So if you guys have, again, any questions on anything to do with the website or how we can improve it, please let us know.
And if there's no questions, then we can wrap up. And again, everybody has that email if you do have questions or want to submit resources. And we're always open to working individually with new members to kind of figure out that website. Thank you, Maria, for sharing all of that. I think that's it. Sonia, did you have anything else that you wanted to add? Not to put you on the spot.
No, I just want to welcome all the new members and say that part of the NBDPN, that's the advantage, is helping to do the work. I know that everybody's busy, but doing that work helps you to really make an impact on the field of birth defects. And so consider getting involved. You can get involved in a small area first, and then next time you'll be on the board, and the next time you'll be chair of the board. So it can happen quickly. So I hope all of you will consider volunteering for one of the committees or one of the some of the work that needs to be done as NBDPN. I think you'll really enjoy it.
We will also share this presentation on the website as well, so you have it there for your information.
Great. Well, thank you all so much. I hope everybody has a wonderful afternoon and a wonderful Thanksgiving, and can't wait to see you all in person when we can finally have an in-person meeting again.
Thank you.
Thank you, everyone.